Hi everyone, welcome to the 6th episode of my COVID recovery series where I interview patients from all over the world who have recovered from the coronavirus successfully, and also movers and shakers from all over the world who are fighting this fight. Now tonight we are going to Connecticut, and as many of you know, Connecticut is a small state with over 20,000 confirmed cases and nearly 1,400 deaths. These are high numbers for this small state. But despite all the hardship, there are incredible people who are fighting on the front line. Now tonight, it is such a pleasure to have one of these incredible people who is fighting on many fronts. He is a physician, he is a policymaker, and he's joining me from Connecticut. Dr. Saud Anwar is a pulmonary specialist, critical care doctor, and the state senator from South Windsor, Connecticut. He was also formerly the mayor of Connecticut, Hartford, Connecticut, I should say, and that's when I spoke with him last. Let's see if we can bring Dr. Saud Anwar into the conversation. There he is, but I cannot bring him in. Dr. Anwar, we will be with you very shortly. Let's see. Go live. Oh, there we go. I figured it out.
There.
Hi, Dr. Anwar.
Yes. How are you?
How are you?
Excellent. Thank you for having me.
But I can't see you. And I'm sure the viewers can't see you.
Okay, let me figure out what's going on.
But I think it's connecting.
Yeah, now you can.
There we go. Hi.
Good to see you.
Good to see you.
Thank you for having me, Tara.
Thank you so much for taking the time. I can't believe time flew by so fast. Last we spoke was when I was still in New York with Al Jazeera. It was pre-election 2016, and we were talking about Muslim Americans and how the community feels about Donald Trump, the candidate at the time.
Yes, yes. Don't ask me about that. I'm fasting, so I'll have to tell you the truth.
Well, first of all, I hope you started a blessed Ramadan to you and the rest of the Muslim community in the United States and around the world. It certainly is a critical time, and I want to talk to you about that, Doctor. But first, how are you doing? How's your family doing? You work on both fronts, both at the hospital, but also at the Capitol. How are you holding up? How's your family?
We're very blessed. Everything is going well. Today is a beautiful day, and every day you take as it comes.
Excellent. And are you at the hospital full time?
So I'm covering the hospital. I'm the backup, and then I'm doing outpatient today. So we are 5 of us. So I'm either at the hospital or doing office, which is through telehealth right now.
Right. Like I said earlier, Connecticut is a very small state, but it has over 20,000 confirmed cases and nearly 1,400 deaths. How is the situation looking right now on the ground? Let's talk about that briefly.
Sure. So if you think about it, New York is literally the epicenter of the COVID epidemic in the United States, and Connecticut borders with New York, and it's a densely populated part of the country. And if you look at the Route 95, the entire 95 and 91 belt, that's where most of the cases are in the southern part of the state, and they're moving more towards Hartford. So it's a matter of time we're going to start to see more cases towards the northeast of the state, but the southwest of the state has had a significant burden of disease in our state. And even though people don't look at it like this, but our state is also an aging state, and then we are seeing some of the outbreaks in nursing homes and assisted livings, and that's facilities, and that's caused a number of deaths to be higher.
Would you say that the majority of deaths were among the elderly and in those caring centers?
So in these centers, yes, it's the elderly, but the disease attacks everybody. It's an equal opportunity attacker, if you will. And then I have seen patients of young age as well. I've seen people in the 30s in the intensive care unit, and I've seen patients in the 90s in the ICU as well. So it is impacting people, and we are getting sick at all age groups.
I see. But right now, today, April 24th, would you say that the state is succeeding in containing the virus, or not yet? We haven't yet seen that.
So we are seeing a decrease in the number of cases, which means that we are closing towards a plateau. But Tara, we are a few outbreaks away in nursing homes to just change everything. So it's not one till it's one, and so we just have to stay the course and then continue to make sure that everybody stays safe and indoors and away from public, and maintain the responsibility that majority of the people have.
Right. So people should stay home, maintain social distancing, and really pay attention to that, because the danger is not completely gone. But I want to talk about some good stuff,
Sure.
because that's really why I started the program. Now, along with two others, and please correct me, Kevin Dyer of InterPro, a 3D printing and manufacturing company based in Connecticut, as well as Robert Connolly, who's an engineer, you helped create a ventilator that essentially serves up to 7 patients. And as many people around the world, and also the United States, know, there is a massive shortage of ventilators. And for those critically ill, ventilators are essential for their livelihood.
Yes.
Tell me about that. How did this come to life?
So I'm a frontline physician. I'm a critical care doctor. So that's what I do. And one of the parts of a critical care physician is to do whatever it takes to save the life of patients. So with this in mind, it was pretty easy to understand that we do not have enough ventilators. So if you do the math, if the population, half the population gets infected, or even more than that, and then about 5% of them land into the intensive care units or on machines. We had 1,000 ventilators in the state of Connecticut, and we were anticipating 80,000 people who could potentially get sick over time in the beginning. So I knew that it was not possible with the existing resource to win at this point. And then so that's why we started to think outside the box and looked at various strategies and trying to fight for each and every life if we could. Now, we did not create a ventilator, but what we created was an adapter, which actually it's a quad adapter, which can attach to the inspiratory and the expiratory part of the machine, and can split it into a way where we can have breaths be given to many patients. So even though we stopped at 7, we could have gone up to 10 if we wanted to. We ran out of artificial lungs, so we just went with 7. And showed that it could be done. And also one of the other things we did was all of us were pretty clear about this, that this was not a money-making thing. We wanted to actually make it open source for each and everyone in the entire world who wants to download it and use it, and then hopefully use it. If people don't have the disaster, it's a blessing. If they do, it's at least a tool that they have.
Right, and I want to talk about that actually, because I read that you put the design on your Facebook page, so did the other 2 colleagues of yours, and it has been downloaded in more than 100 countries. Tell me about that.
Yes, it has been downloaded across the board. Can you hear me?
Yes.
Yeah. So it got downloaded in hundreds of countries and hundreds of cities across the United States and hundreds of countries in the world. And then this was pretty amazing from that point of view, and then showed how much the needs had been in the community. So, and I've been talking to people in at least people in 2 different countries every day about what they could do, how they would manage this if necessary.
Which countries, can I ask?
Can you hear me, Tara? I lost you for a second.
Yes.
Oh, now I can
No,
hear
no,
you.
no. I said countries where you mentioned.
So I recently had a conversation with the people in Saudi Arabia and had them in Ecuador and then Dubai, in Pakistan. And those are some of the ones that I've had recently. And then I've also seen people across sending pictures of the printed thing that they're sending over from different places.
So let's talk about this design briefly. I
Sure,
understand that it was done with a 3D printer. Is that correct?
correct. And
So anybody who has this design can either make it with a 3D printer or make it just with the products. Can you explain that a little bit?
sure. So
Because what
here's
if people
what
don't have in certain countries access to a 3D printer? That's where I'm
yeah.
getting.
So that's going to be a challenge, but the concept of what can be done is pretty straightforward. So what we are doing is we are trying to split the outcoming valve from the machine that gives the inspiration. So if we can actually split it into different parts, and as we split it, there's an opportunity to split it in 2 parts or 4, and as a result of each one of those options, we have a capacity to give the breath in and then have the ventilator be fooled into thinking it's giving a breath to one person, but instead it's actually giving a breath to more than one person. And you can actually maneuver the machine in such a way that you can bypass its brain. So we do that. And with the printing, what we did was we looked at a couple of models initially, and there were some challenges with that. And then so we actually did a few more testing and adjusted the design and made it to the simplest form and a way it would actually provide the breath and it wouldn't take away from any other patient's breath. And then we tried to look at the numbers and they look pretty good.
Wow. Uh, it's incredible how technology and sharing that information online can help communities that are in need. I know, for example, in Syria, a war-torn country that has been facing conflict for nearly a decade, over a decade, had only one ventilator, and right now people are making makeshift ventilators. Or in places like Yemen or Bangladesh, where people don't have access to the basic health care. How do you think physicians like yourself can create modalities or online videos or create blueprints of things to do where people in those communities can have access to things that are life-saving?
Tara, I think you're absolutely right. I mean, this whole pandemic is going to change how we look at things going forward. It's going to give us a stronger sense of a global community and a global responsibility. The infections in one part of the world can go to the other part of the world. The challenges that people are facing in one part of the world impact us as well. So we have to recognize that reality, accept that reality, and be a part of a solution for everyone wherever they are, and be a responsible human in doing that. If one has some skills, they have had some capacity and opportunity to learn about something, and somebody else has not, then it needs to be shared. And knowledge is a responsibility.
Right. How do you feel when you see someone in South Africa downloading the design that you made and used it to save a life? Because I know that it was printed in South Africa.
Yes. Well, it's humbling, and it's end of the day, it's the people who are doing it, and then we are just playing a role. We just have to have the humility because the healing comes from higher powers. We are just little pieces of that, the higher powers instruments, and we just stay humble about it.
Wow. Now, Dr. Anwar, you are part of the immigrant community. You are Pakistani-American, you're Muslim-American, and really you represent the very diverse immigrant community in the United States. And I want to talk about that. I understand that more than 400,000 immigrants made up in 2018 the healthcare workforce in New York State alone. So 1/3 of the healthcare workers in New York were immigrants. Before this pandemic, the last 1, 2, 3 years, we have seen a wave of anti-immigrant sentiments, anti-Muslim sentiments, and really just divisive sentiments, I should say. How do you think right now there's an opportunity for the American community at large to see the contribution that the immigrants make to the daily lives of people here in the United States?
Yes, Tara. I think what we had seen was unprecedented in the last few years, where people who know better, who should have a decency to understand about humanity and humans, and who are in the positions of responsibility, and who are supposed to unite our society, unite the people, they actually were actively dividing the society, dividing the people. And it was not out of the blue. It came from a deep position that they have felt and they have acted on in the past. That's one thing. And then there is money to be made by dividing people. When you dehumanize certain people, it's okay to use war machines to kill them, because you don't harm people who you humanize. And I think that's our challenge in the world right now, is that there are industries who have significant influence on elected positions or elected officials, and they can actually be a part of the machinery to dehumanize people and make it easy to harm fellow humans in different forms. I think this pandemic humanizes all humans, because the suffering that we are seeing in Mexico, the suffering that we are seeing in United States, the suffering that we are seeing in Korea, all parts of the world, China, you name it, they actually are suffering the same way, and we are learning from each other, and then we are feeling the suffering of each and every one of our fellow human beings, and we are trying to save as many lives as we can with what we have. And I think end of the day, hate is not a sustainable emotion. Hate is not a sustainable policy. And people wake up to it, because we are not made for this. It's like trying to put something into a plug where it doesn't fit, and you keep hammering it and it just breaks it. And then that's why we are seeing so many problems emotionally with people, because they're being given mixed messages and wrong messages. End of the day, everybody's going to come back to realize that they are humans, and all humans are equal, and we have to respect and love all of them.
Well, let's hope that this pandemic is really waking that up, especially with this large waves of immigrants working not just in the US, but in Europe, elsewhere, contributing to this fight. I want to ask you about actually how right now, I want to go back to Ramadan. What's your advice to the Muslim American community and actually Muslim communities elsewhere who want to fast and participate in the practices of this holy month, but may have difficulty doing so?
Yeah. So I think that this is the one of the most blessed months for the Muslims, and it's a special month, and this is also an opportunity to have internal reflection. It's all about realigning yourself with your reality and being closer to the beloved, and then being closer to fellow beings and human beings included in that. And that also requires us to give back. What is it that we can give to people? Is it resources? So it is pandemic has brought about the opportunity for internal reflection to be at a different and a higher level. And it's also given us the opportunity to give to the people around us. The people, we have highest percentage of people in the history of the country who are actually unemployed. There are people who are waiting in line to get food in the United States, which is real for my neighbors, my communities and people. So we have a responsibility to give to our fellow brothers and sisters who are hurting, and be a part of their solution. And then recognize that hunger is universal now at this point, unfortunately, and we are supposed to feel that hunger, but use that energy from that hunger to be a better human being and a supporter for our families and friends. The other part I just want to add, sorry, Tara, is that, but it has to be done at home. It has to be done with a distance. And I think that's a part that's critical, because, and I have to put this hashtag RamadanAtHome, because the last thing we want to do is to spread the virus. And then we have to protect our fellow friends and neighbors. The same mindset that we have to protect them. And that can be done by staying at home and keeping the distance.
I Excellent. So the same spirit of giving and generosity and really absorbing and also giving all the blessings can be done at home. And I think that's a powerful message that people like yourself should amplify during these critical times. But I want to pick up on your point about hunger, because I know that you are an avid supporter of this particular charity. And from my guests, I ask each of them which charities they're supporting, because there are viewers who may want to give back, who are interested in different organizations around the world. And I know that Food Share is the charity of your choice. Can you tell us about that? And I'll share a link for our viewers to see.
Sure.
But it would be great if we can talk about Food Share.
So Food Share is an organization very dear to me. I'm a volunteer for them as well, and I have worked with them for quite some time with respect to the work that they're doing. Look, when we do charity, we need to have sustainability built into it. Mm-hmm. And that's the part that is missing at times. And hunger is real. Hunger is very common in our towns. Mm-hmm. People in affluent towns are going through struggles. So what Food Share has done is they have actually created hunger action teams in every neighborhood and every town. And these hunger action teams are volunteers who come together on a monthly basis at minimum or more frequently and create an organized way of trying to take care of the most vulnerable people in the communities. And Food Share's work has gone up exponentially since this pandemic started. And right now, every single day in one of the big Rentschler Field in East Hartford, which is one of my towns, mm-hmm. As well, they actually have a distribution of food for people. No question asked. People just have to drive by and pick up any food that they would want. And we have had people in line for hours and miles long lines of cars waiting to get the food, and they're doing it every single day right now to help the people. So this is an amazing group that they are doing it, and they've been doing it all along, but the work is increased now.
Right, and I'm sure that the need has increased now, yes, given the pandemic. I have one question about the ventilator before I forget. Actually, I should have asked that earlier. I understand, based on the last report, an article I read, that it hasn't been used in Connecticut. But as we discussed, New York and California were having a mass shortage of ventilators. Was this equipment module you guys created used in California or New York?
So this whole concept was used back when there was this mass shooting in Las Vegas. And then when there was this mass shooting in Las Vegas, that one of the emergency room doctors had used it, and it worked and it helped the people. Right now, people across the country in the United States, every city, they have this whole concept down. I know that people were ready to use it. They have not reported back about their use, but it's a matter of time. When the dust settles and when they are able to take a breather from the current disaster, they will share what they have been able to do and what has worked. So
right, and I think it's so important that people like yourself share the work that they're doing, even though it's not going to be immediately used, or you may never find out if that was used
right.
in whatever state, but the information is out there, and the fact that you're putting it out there, that's important. And I think you are a policymaker, but you're also a physician, and I want to ask you, what is your message, doctor, to policymakers and politicians right now who are using this pandemic for their own political gain? What do you say to these folks right now?
What I would say is that, look, disasters bring the best in humans, and they can bring the worst in humans. Be in the former and do the best for people. People get elected and they do lose elections, they win elections, but your humanity stays with you. Your actions stay with you. And this is the time to do the best for all the people who are suffering, and there's a lot of people suffering. And elections will come and go, but our responsibilities right now will stay with us forever for how we were responsive to the needs of the people at this critical time.
Well, doctor, I am sure many people are grateful for your service and your work, and people in Connecticut are very lucky to have a state senator and physician like yourself. I'm very grateful that you joined me, and I hope that my viewers from around the world mainly got to learn about the great work that you're doing, and folks like yourself who make this beautiful and diverse community that exists in the United States. Thank you
Thank you,
so much.
Tara, for having me. Thank you. I feel blessed to
Thank
be
you.
part of your program and conversation. Thank you.
Thank you so much. Have a blessed day.
Okay.
Bye-bye.
You too.
Thank you.
Bye-bye.